Welcome back to Cancer Buzz. I'm your host, Summer Johnson. In this mini episode, we conclude our two-part examination into the pandemic's impact on the resources and operations of cancer programs and practices. Cancer care teams were forced to make quick and creative modifications to care delivery over the past year, leading to some incredible discoveries in the way they administered programs, while taking care of their staff, patients, and community. ACCC gathered examples of these changes in areas such as staffing, operations, revenue optimization, and technology in its latest Trending Now in Cancer Care 2020 report. Today's guest is here to talk about her cancer program's care modifications and the surprising takeaways she hopes will permanently sustain. Dr. Una Hopkins is the Director of Nursing Research and Evidence-Based Practice at Montefiore Medical Center in the Bronx, New York.
So Montefiore developed an algorithm with its interdisciplinary team and our chairman of oncology, and they developed this algorithm that facilitated us understanding whether, one, the patient was to get treated, two, if they were COVID positive or not, three, if they were COVID positive, could they afford to wait to receive their therapy until they had made it through that 14-day quarantine aspect. And the fourth population was those that were COVID negative and, maintaining a current regimen and how they needed to continue that. So we had to look at facilities. We had to look at where we could treat patients. We had to look at the amount of PPE we had. And I think oncology was one of the first service lines to do temperature checks on patients before they, arrived into an actual unit. So that staffing was very taxing because everybody was kind of deployed in the first wave of COVID, and some were deployed to do various different things, whether it was to help somebody make sure that they had the appropriate PPE on, or somebody that was doing a temperature check, and then to figure out if they did have a temperature, where they were sending them and how they were going to get evaluated. In addition to all of that, telemedicine just went and had a complete burst, and it was very, very helpful. And I think that our nurse practitioners and PAs really did jump into action there to be able to do a lot of the follow-up visits via telemedicine.
What do you think will return back to normal as far as operations go? And then what do you think your facility will keep permanent going forward?
I think what will stay is temperature checks. I think that what will stay is a pre-screening of a patient before they come to the facility. I think that what also will stay, and it's always been a bane of existence for an oncology patient, is to have their labs drawn before they actually get due for their chemotherapeutics. So that costs them sometimes 30 minutes, sometimes 90 minutes, and then they could get their treatment. So it made it an all-day factor, whereas we were trying desperately to streamline things as best we could. And because we could only treat a certain amount of volume with social distancing and seeing patients in the outpatient setting, we streamlined a lot of that. So their labs were done ahead of time. And that also was a patient-centric, wonderful change.
When we were talking on email before this, you said that, quote, we moved 10 years of innovation into months, and we also moved the word collaboration to a new level in healthcare. Do you want to expand upon that?
I think patients have come to realize what their needs are, and we've come to meet them in the middle. And when I mean collaboration, it's not only on the interpatient collaboration, because again, we got a bird's eye view into their home settings, into what they could really use and need. But what I also meant was collaboration not only intraprofessionally amongst our nurses, our physicians, our social workers, our nutritionists, our dietitians, our lab folks. There was just so much collaboration amongst the interdisciplinary team. And then on another higher level, it was collaboration from hospital to hospital. Like normally you are in a competitive scene, right? One hospital system and another hospital system, and we all work together in our same geography. And the Bronx was hit pretty hard. So being able to collaborate with not only sister hospitals within your own health system, but hospitals outside of your system. So when I meant the collaboration was just amazing, it was not only between provider and patient, but it was provider to provider to the interdisciplinary team, and our teams themselves, our hospital teams, with other hospital teams.
We've been talking a lot on this program about the future mark COVID will have on cancer care, many of them really positive. You have an interesting perspective, I think, on the respect between healthcare professionals.
Out of every bad thing comes something good, or a rainbow can be found from every bad storm if you look for it. And I think if we try to continue to find what the caveats were that we did really well in understanding how we handle COVID, not only from our staffing perspective, but understand how, if we had to deal with another pandemic, what lessons have we actually learned and how do we move those forward? I know from a nursing standpoint, we did a lot of team nursing, which I am a nurse of 38 years. And initially we did do team nursing, and then we ended up moving to primary care nursing. And in this pandemic, because of staffing and people that had to go out on furloughs and people that were in quarantine for the length of time that they were, we needed to really have a team-based nursing. But it wasn't just nurses, it was a whole team. And people were moved out of their own comfort zone. So you might have an infectious disease physician working in the ICU. And of course, there's various different skill sets. And as we in nursing have also learned and knew that there's different skill sets between a cardiology nurse, an intensive care nurse, a med-surg nurse, an oncology nurse. And we all had to move in various different areas. So I think the degree of respect that we have for one another is better. The degree of teamwork is better. And if we can learn the good lessons that we learned while we were doing all of that, I think we'll be a better healthcare system overall as we move forward in the future.
You can find ACCC's Trending Now in Cancer Care 2020 report on the ACCC website and in the latest Oncology Issues Journal. Next time on Cancer Buzz, we'll explore the impact of advanced practice providers on care coordination, and you won't want to miss it. Until then, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.